All right, good afternoon, everyone, and welcome to this community meeting. Thank you so much for joining us today. This meeting will also be available on YouTube, so we can go back. You can share the link with your friends and family to share this message as we go through. If you're unable to, if not everyone is able to join us tonight. So I can see our participant number is growing. So I'm going to just wait a few minutes to officially kick us off until that stabilizes and it seems like everybody has been able to join. All right, so yeah, it looks like we have about 150 people with us tonight. Good evening, my name is Molly Dick. I'm the Assistant County Executive Officer for Nevada County. I'm joined today by Ryan Groover, who is our Health and Human Services Agency Director. Also Scott Lay, the Superintendent of Schools for Nevada County. We have Dr. Evans from Sierra Nevada Memorial Hospital, as well as Michael LaMarca of the Sierra Theaters. So we have asked this panel to come together and talk about the implications and the next steps as far as Nevada County being in the purple tier. And I'm going to go ahead and turn it over to Ryan Groover to speak first.
Thank you. I'm Ryan Groover. I'm the county's Health and Human Services Agency Director, and I have a brief PowerPoint. I'll try to make it short and sweet so we can get to our other panelists, but bear with me while I get the PowerPoint up and running here. So I'm going to ask for a thumbs up to confirm that the panelists see what's on the screen here. All right, great. So first of all, just want to draw your attention to the county's COVID-19 dashboard. If you're not familiar with this already, you can go out and check it out on the county's website, mynevadacounty.com/coronavirus. And you can track the latest in terms of what we're seeing with COVID in Nevada County. As of today's update, Nevada County has 929 COVID cases, of which 201 are active. That's a large number of active cases. It's the largest number that we've seen throughout this. Early on, our public health department estimated that they could handle approximately 45 active COVID cases, and they've expanded far beyond that and built capacity so that we can continue to use containment as much as possible. For every active case, there are approximately 6 to 10 close contacts of those cases who are also being quarantined and managed by public health to ensure that they're not spreading additional cases in our community. So the cases that we have are significant. Luckily, we've continued to see relatively stable hospitalizations. I'll talk a little bit more about that going forward. We continue to be at 9 deaths, but with the significant uptick that we're experiencing, it tends to lag a little bit behind an uptick in cases when we start to see additional hospitalizations, and unfortunately, particularly as we get into vulnerable communities, additional deaths in our communities. So just a very brief note, as I advance the PowerPoint slide here. So this is just a quick glance at the cases that we've experienced since October. The first little teeny bar that you see on there is the October 1st, and you can see the significant uptick that we've had in recent days, and particularly Friday going into the weekend. We had 44 cases on Friday, 47 over the weekend, and then 28 today. And so we continue to see significant spread in Nevada County. So wanted to give you a little bit of a brief glance at the themes that we're seeing in the cases. The first thing I wanted to point out is that most of the cases that we're seeing are preventable if people are following the guidelines. If people maintain distance, refrain from gatherings, wear their face coverings, we don't have to be in the situation that we're in right now. In terms of where we're seeing the cases, there is and has been a trend of small family gatherings, larger gatherings, parties being a key source of spread in our community. There were quite a few Halloween parties and cases related to Halloween parties that we've seen in recent weeks. We're also seeing quite a few workplace exposures. So we have good and bad examples of COVID-19 in the workplace in terms of how employers are handling that, how employers are setting up their workforce to make sure that if somebody does end up having COVID, that they don't have to quarantine their whole workforce. So, but unfortunately, we have seen cases of spread within workplaces. And then additionally, as we've seen an uptick, not just in Nevada County, but throughout California and throughout the nation, there's widespread community transmission going on. And that's when it's out in the community and it's very difficult to tell where somebody is actually picking up COVID because they've been exposed to so many potential sources of it that it's impossible to identify the actual source. Just a little bit in terms of what this means and why we should all be concerned and some of the implications that this uptick has. There have been a lot of reports in recent days and weeks about the testing system being impinged again. It's become very difficult to get an appointment for testing. Want to get the message out that it remains important to get tested, particularly if you're symptomatic. The county has state-provided testing sites in both Grass Valley and Truckee, and you can also get testing through your medical providers, through the clinics, and through other sources in the community. But testing appointments have become scarce and difficult to get. Hospital capacity can become an impact. The governor mentioned yesterday that there has been quite a bit of work put into increasing the ability of hospitals and their surge capacity to handle additional patients. I know our local hospitals have also done a tremendous job in that, but there is an uptick in hospitalizations. And if this trend continues, certainly that would be a big concern if we started to run out of capacity in the hospital system. As we see widespread community transmission, it becomes just a matter of time before somebody brings COVID into a skilled nursing facility or a senior congregate living facility where, unfortunately, that is where we tend to see the most dire consequences for people. And then outbreaks in schools become more likely as we see additional community transmission as well. So these are all main concerns. They're not the only concerns with COVID, but certainly some of why this is such a big deal. So in response to what's going on at the state level on Monday, I guess that was yesterday, it seems a lot longer than that, the governor announced that they are putting on the emergency brake in the state's tiered COVID-19 framework. And what that means for Nevada County is that we'll be moving back to the purple most restrictive tier. When this framework was announced, we were actually in the second most restrictive tier. So we're now in a more restrictive tier than we've ever been in the county. And I'll talk a little bit more about what that means in Nevada County. But first, I just wanted to give you a little bit of history of that framework and where we've been in it. So there are two main metrics that go into the state's tiered framework. The first is the case rate. That's the number of cases per day per 100,000. And the second is the positivity rate. That's the percentage of COVID-19 tests that result in a positive result. And so you can see in the beginning, we were placed into the red framework in terms of the case rate. We were in the orange tier in terms of the positivity rate. They actually put you in the tier that's more restrictive if your data falls into multiple categories. So you can see in terms of case rate that we started in red, we went down to orange, we almost got down to yellow, the least restrictive tier. And then since early October, we've really seen a pretty drastic uptick. And as of the data update yesterday, we were at 14 cases per day per 100,000. In terms of the positivity rate, we have been a little bit better. We started in orange, went down into yellow, but then recently we're also ticking up in the positivity rate as well. So both of those are obviously concerning trajectories. Again, if you look at that case rate, you can't necessarily draw a one-to-one ratio between our dashboard and what makes it up into the metrics, but with 28 cases today and our case rate being 14 over the time frame the state was looking at, you can see that we're still adding cases at a rate that is very concerning from the perspective of this framework. So in terms of what that means for businesses, so we were at the orange tier as of Sunday, and that meant that a lot of businesses were able to operate indoors at significant capacity, and other sectors apart from businesses as well. So you had retail shopping with no cap, places of worship 50%, movie theaters 50%, gyms and fitness centers 25%, restaurants 50%, wineries 25%, bars and breweries could operate in the orange tier. Family entertainment was open at 25%, and then offices were allowed to be open indoors with modifications, including social distancing and those things. We actually jumped the red tier, which would be the next most restrictive tier, and the state put us right back in purple because the data that they were seeing in ours and many other counties were so troubling. And unfortunately, that means shopping is at 25%. You can see all these sectors that are outdoor only. Bars and breweries are actually not allowed to operate at all if they don't serve food now. And then offices are supposed to be going to remote only. So that's a concerning way to go, particularly when, I mean, it's raining right now, so outdoor activities are going to be difficult for a lot of these sectors. But I did want to just point out what we need to do to get back to orange and red. It's not something that is a mystery. The state put out this framework so that we could see what we need to achieve in order to have more openness in our sectors. So what we need to do to get down to the red tier is get our case rate below 7 per day per 100,000 and our positivity rate below 8%. So we're there in terms of the positivity rate. We have to get that case rate down, and then you can see the additional levels for the other tiers. But I just want to emphasize that we do know how to beat this. It's incumbent upon all of us to do what we know works against COVID. Maintain that social distancing, wear your masks, make sure you're sanitizing and hand washing, and please, as we go into the holiday season, be extra careful. They're encouraging everybody to try to celebrate virtually if you can. If you do celebrate in person, the state has made available guidance in terms of how to do that safely, and I can put that a link to that in the chat for the benefit of the group. And then, yeah, that's all I have. I don't know how much time we have for questions, Molly, but I'm happy to answer them if we do have time.
Thank you so much, Ryan. There is, I think, a couple of questions that maybe you could look at in the Q&A or the chat that you could respond to in writing, but we're going to go ahead and move on to Scott Lay, our superintendent of schools. As I know he has another meeting he's going to have to jump off and leave us to attend to. So Scott, thank you so much for being here. You are muted.
Thank you, Molly. And you'd think by now we'd get that mute, unmute down. And Ryan, thank you for setting the stage. As Ryan mentioned, we are seeing a substantial increase in COVID cases, positive COVID cases in our schools. Almost all districts have at least one case or have had one right now. So far to this point, we've had no known transmission of COVID in the schools as of noon today. We're seeing more students in the schools opting to go back to distance learning. There has been a dramatic increase in that over the last week as the cases started to increase. At this point in time, the case numbers in our school don't require us to move to distance learning wholly, even though we're in the purple tier, because we are open. But there are other factors that may push us in that direction. The biggest issue schools are facing right now is the lack of substitute teachers. This has been an issue that we knew was coming. We have been actively recruiting for the last 2 months to try to get more substitute teachers available, but we've not had a great deal of success with that. So we are seeing schools that are unable to staff with substitute teachers. They're bringing in paras, they're bringing in principals, superintendents, assistant soups, trying to make it work, but we're getting to the point where we may not have enough staff to do that. So that's big. As Ryan also mentioned, the testing times have increased over the last couple of weeks. We're seeing sometimes it's taking 11, 12 days for someone to get in, get tested, get the results back. So that becomes problematic in terms of the time staff is out waiting to find out, are they positive or are they not? And so those are two really big issues. We are working on those. We're in constant contact with public health. As I mentioned, we're actively recruiting for subs. We're also actively working with insurance companies and our other partner agencies to see if we can get other testing in Nevada County for our schools, potentially housing them here at my county office, to do whatever we can to get these tests to turn things around and stay open. The discussions right now are ranging from, as you can guess, staying open as we are now. At the other end of the spectrum would be to do a potential closure and go back to distance learning between Thanksgiving and Christmas. Now, that's nothing that's been decided yet, but I'm sure everybody who is out there has probably thought those same things, and we have too. So we're looking at that. That is the least favorite option of us. We know the impact of that on the community. We know the impact on parents and students. We're in a time where there is no good option right now. Unfortunately, we don't want to be part of the cause of spread. As I mentioned, there hasn't been any yet. We feel very good about the procedures we have in place and protocols, but we are keeping an eye on that. and things that, that community can do is keep on being vigilant. I know we're all getting very tired of COVID. I think we're seeing results of some COVID burnout. We all have it. Nobody likes wearing the masks. People want to hug others, but we have to stay vigilant to keep our schools open. And that supports our community, that supports the parents out there, and the mental health of our students, which I'm greatly concerned about. So please stay the course. Keep those distancings, those procedures, those protocols we have in place, and to make sure. As Molly mentioned, I am jumping after this meeting in about 8 minutes. I've got a meeting with all the district superintendents, charter school directors, and public health, where we'll be discussing where we're at further. And certainly as decisions are made, we will be messaging those out to all the parents and the community. If parents need to know what is going on specifically, I would refer you back to your district or charter school's webpage. They will have updates. I will also be sending updates out through our county office webpage. So please keep an eye on that. Kind of that's where we're at in a nutshell right now, Molly.
Thank you, Scott. And yeah, we really appreciate that update and recognize that you need to jump off soon to your other meeting. And so if any questions come up that we can't answer, we'll make sure we get back to people after we can connect with Scott and get those answers. But I know you'll be in communication with your parents as soon as you have more information. So thank you.
Yeah, thanks. And have them, if you can have Taylor, so they can forward me the emails and I can take care of those. Thank you.
Thank you so much. Okay, next we're going to hear from Dr. Brian Evans of Sierra Nevada Memorial Hospital.
Thanks, Molly. Appreciate the opportunity to talk about the hospital with all of you in this pandemic situation. I'm going to go ahead and just kind of give you an idea of how things are going on the ground at the hospital. I've been watching these numbers too, and Ryan did a really nice job of kind of explaining, where we are at this particular moment in time. And I'm definitely concerned about the trend that we're seeing with the uptick in cases. And in my mind, I'm always thinking about how is that going to impact the hospital? Where is this going to go to, how is that going to affect our ability to take care of this community? And how many inpatients are we going to end up having? How many ER patients are we going to end up having? And how's it going to affect our own employees too? So that's kind of the framework I start from. Just to give you an idea about the census, because people always ask me, like, how many people are in the hospital with COVID-19? For the most part, during this pandemic, it's been a patient or two. That's basically been our inpatient number. Right now we have 4. We have been tracking that every single day. We are absolutely able to take care of 4 patients, no problem. That's not something that is going to tax our system very much. The question is, if this trend continues, what will happen in the hospital? I also track very closely the census in our partner hospitals in the Sacramento division. We're part of a division of hospitals in Dignity Health. So we're tracking Mercy San Juan and Mercy General and Methodist and Woodland and Folsom. And what we've seen in those hospitals is right now their census is about 90 total. That's more than doubled in the last week and a half, basically. And so that's a bit of a concern. And they're getting to the point where they're starting to feel the strain of that. We've certainly seen other hospitals in our Dignity Health system, especially St. Joe's and Stockton, get to a point where they were essentially overwhelmed. And that's obviously what we want to avoid here. I think all hospitals want to avoid getting overwhelmed, but in particular, a rural hospital where we are more limited in terms of our ability to expand with staffing and other things. We really need to be very careful about that because we just don't have the reserves that other places do in urban areas. When you think about capacity, and people ask a lot of questions of me about, how much capacity does Sierra Nevada have for an increased number of patients? And they ask questions about how many ICU beds do you have? How many ventilators do you have? How many total beds do you have? And those are good questions. We have plenty of these things, generally speaking. I kind of break it down into a couple different categories. Supplies are one, and what we've seen in this pandemic is a disruption to the supply chain. We've been working on that since February, basically, and we've gotten our arms around that to a certain extent. But we're still seeing issues related to supplies, certain supplies in particular. where all of a sudden the demand goes up nationally or internationally, and it disrupts our ability to get certain things like masks or like gloves. But right now we're doing just fine on supplies. We're watching it very closely. Equipment is another one. So people have asked, how many ventilators do you have at the hospital? We have plenty of ventilators. And interestingly, the way that COVID-19 was treated earlier in the pandemic has evolved over time, and physicians and nurses have realized that it's better actually to avoid putting patients on a ventilator early and doing doing other types of oxygen delivery on the front end of their illness, and really not put people on a ventilator until they absolutely have to have it. But we have plenty of ventilators at Sierra Nevada. The facility itself, we're licensed for 104 patients, and we have a 10-bed ICU. We have the ability to expand our ICU as needed. 104 patients, though, we haven't had 104 admitted patients at Sierra Nevada since I've been here, and that's been 20 years. So, we do have the ability to expand. The thing I worry about the most, though, is the last category of capacity, and that's people. So, when you think about all the people that we need in order to take care of patients, especially people who are really ill, we need nurses, obviously, we need doctors, we need techs, we need lab personnel, we need phlebotomists, we need a whole host of people to take care of patients. And our ability to do that is somewhat affected by the pandemic as well, because we're starting to see that nurses are being redistributed nationally. We haven't been able to get as many traveler nurses this year, as an example, as we normally would. So, our ability to respond to a huge surge in COVID patients is going to be limited somewhat by how many people we have. So right now, again, doing just fine. But if this pandemic continues to get worse and our own employees potentially are getting infected by COVID-19 or having to quarantine, that will affect our ability to manage this, and we could fill up pretty easily. And as Ryan talked about, some of these high-risk centers are particularly concerning. Skilled nursing facilities, assisted living facilities. If we start to see big numbers of elderly patients, especially those who have chronic medical conditions, that could fill up the hospital very quickly. So those are some of the things that I'm thinking about. We've been working on our surge plan since the beginning. We always have had a surge plan. We've updated it continuously throughout this pandemic. We've adapted our screening plans for people coming on campus. We're limiting somewhat. We don't have volunteers on campus right now. We're limiting visitors actually to patients to some degree, although patients can still have visitors, but we are very careful with that. We're universally masking on campus. So every person that's on campus is masking. So we assume that COVID, is around, and we're just really trying to prevent it. Of course, universal masking needs to happen outside the hospital as well. And then we're keeping very close track of all the treatments so that Sierra Nevada can treat patients with COVID-19 at the highest possible level. And we do that in a variety of different ways. We partner with a lot of expertise and physicians regionally, especially at Mercy San Juan, but other places as well. We are keeping track of all the medical literature and using things like remdesivir, although remdesivir data is not as good as it was at the beginning of the pandemic. We've used convalescent plasma. We're looking at processes for treating with monoclonal antibodies. Probably all of you have seen data come out on monoclonal antibodies recently. And then we're looking at our processes for the administration of flu vaccines when they're available and when the data is more solid. I'm concerned about this uptick. I'm concerned about the mental health of our employees. I'm concerned about the mental health of our community. I too, just like others have expressed, have COVID fatigue. I think that everybody is feeling that. We're really tired of the masks. We're tired of not being able to see our family and our friends. I mean, I haven't seen my mother since February. She's probably happy about that, but I'm not so happy about that. So it's really, it's really been a challenging time, plus with the weather getting to where it is. And then I think some people are getting a false sense of security from the vaccine. They think it's going to turn the corner for us immediately, and that's just not going to be the case. So it really is time for us to buckle down and work together as a community. I want to go back to a less restrictive tier. I want the businesses to be able to be open. I want to be able to go to restaurants and do things like all of you want to be able to do. And in order to get to that, I think we're going to have to work together very hard. So that's basically what I wanted to talk about. And I'm going to take a look at the chat now, Molly, and see if there's anything for me and see if I can answer any questions there, if there's anything on the question and answer section as well.
Great. Thank you so much, Dr. Evans. So next, we've invited Michael LaMarca of Sierra Theaters to join us to really talk about the impacts on local businesses and what we can do to help keep our local businesses, keep their spirits up and keep supporting them through this time. So Michael, thanks so much for being here.
Thanks, Molly. Well, I'm happy to be here and participate because I feel like it has been a consistent communication. The county has been a consistent communication source throughout this entire pandemic. And I'm happy to participate in that because I really do feel like the county has led the way. And I want to thank the supervisors and county staff and county directors for all the hard work that they've done. Without that hard work, we wouldn't have got back to the orange tier. I feel like the communication is absolutely necessary. And right now we're at a critical point as well where communication is going to make all the difference. So stepping back, I feel like we were in the dark at first when this thing happened in March. And slowly we started to get a sense of what we needed to do to get back to work. And those blueprints from the state, as well as the information from the county and support, helped us get back open. And from my business's perspective, we reopened in June. Unfortunately, we reopened right at a moment when the virus was spiking, and we spent about 2 weeks open, and then we're shut down again completely. The same thing just repeated itself in October. Our numbers were down, people were feeling confident. There was a lot of activity in Grass Valley, and people came out to the movies, people came out to the restaurants, people enjoyed the outside environment. And then we saw this recent, very dramatic spike. So now my theater is closed again. The indoor dining is closed again. The impacts are going to be severe and are going to have lasting effects on our quality of life here in Nevada County. And I think, I can't speak from, as any kind of representative of all the businesses in Nevada County, but I can speak from my own business perspective, which is, to be honest, what comes after this virus is no longer the most impactful thing in all of our lives. What's going to be left is going to be a lot different than what we enjoyed before the virus. And that's because no business can sustain this impact for the length of time that is required. There's going to be an impact, whether that means business will not be able to offer the spectrum of services that they used to offer, or whether they have to close certain locations if they have multiple locations. All of those things are going to have a negative impact on our quality of life. And I think that the reason I kind of point that out is to sort of underscore how important it is for us to listen to the science, to actually pay attention to these guidelines. As a business owner, as someone who's been using the guidelines, I have to agree with Dr. Evans. Yes, I'm fatigued of wearing the mask. So are all of my staff. But we did it, and we did it because we knew that that's how we would get back to business. Same thing is true of our patrons coming into the movie theater. Nobody wants to wear a mask through a movie, but people did it because the alternative is that the movie theater goes dark and never comes back online again. And so I think that this is a critical moment for us as a community to recognize that we are all a part of the solution. We all have a responsibility here, and it will have a very direct effect on our quality of life. The sort of wonderful experience of living in the foothills and having all of the wonderful things that you would have if you lived in the city. Well, those things are under threat, and it's going to be harder and harder for businesses to hold on. From just a financial perspective, it's important to recognize that most businesses that received financial support through programs like the PPP or the EIDL disaster loans, those funds are starting to run out if they haven't already run out. We're coming into a time where most businesses are expecting to do their holiday business, which might sustain them for the next quarter or more to get them into the summer shopping and tourist season. But we're not going to have that holiday business. Most of us are not going to have anything that resembles a normal holiday experience from a sales perspective. So what is left? The stimulus is running out. The weather is running out. The virus is running up. The only things we can control are our own behaviors. And here's where individual responsibility is really going to come down and have a major impact, not just on these businesses, but like Dr. Evans, on the hospital and the hospital staff that are going to take care of people when they get sick, and on the teachers that are trying their best to teach our kids despite these challenges. And I really, truly want to underscore how important it is for us to take on these individual responsibilities and recognize that it is a cumulative effect that makes or breaks our county. And those small measures, the distancing, the mask wearing, the foregoing of social gatherings, those small measures are what are going to keep our businesses alive and what's going to keep our quality of life in place once the light at the end of the tunnel shines. And I think that, Dr. Evans also brought up this idea of fatigue, and obviously we're all fatigued by this, but the news of the vaccine has been so encouraging. We even saw in the movie theater industry a giant spike in the stock price of the big movie theater companies the day after the first vaccine news came out. And obviously that is an indication that people can see the future, and the future is bright. We can make it through this. However, it's going to take work. And the unwillingness for individuals to do the small amount of work it takes to wear the mask, to keep your distance, to wash your hands, to forego social gatherings, that small amount of work is going to add up and create an incredible impact if we can get on board right away and start moving back down those tiers. It's going to be absolutely critical to do what needs to be done to salvage whatever sliver of a holiday season these businesses can salvage. I cannot underscore how important holiday sales are to small businesses. And without them, many of them will just simply close in 2021. So I see there's a million questions, and I'm not a representative in any way, and I can't answer the detailed questions about what qualifies for this and what qualifies for that. But I do want to just simply speak to this idea that our own individual efforts, our own individual responsibility on this is going to have a giant impact if we step up.
Thank you so much, Michael. So well said, and I really appreciate your perspective, your due diligence. You're looking at the long view and really recognizing we are going to get through this together, and we will be back in the movie theater at some point, hopefully in 2021 would be great. So there are a lot of questions in the chat as well as in the question and answers, and I know we have people who are trying to keep up with those. I do want to point out a couple of resources. So if you're asking questions about if a hair salon can be open or if a gym can be open, really encourage you to go to the state's website. It's the covid19ca.gov/safer economy. That website, you can put in Nevada County You can type in your business or activity and it will tell you what's allowed and what's not allowed. If that's not clear to you or you're not sure where your business fits in, I encourage you to send an email to us at the county. We have an email address. It's COVID-19 recovery@co.nevada.ca.us. And we respond to all of those emails as soon as we have the information. Some people send us questions that we don't quite know the answer to, and it takes us some time to do the research and get back to you, but we always get back to you with the information that we have. So those are some resources for you if you're wondering about your sector and the impact specifically to your business. As Ryan showed earlier, a very simple table that pretty much showed that everything is either outdoors or closed, which is horrible right now considering the weather and you know, just the difficulty of the shortness of the days with the sunlight, as well as the rain or the snow, and how that's going to impact businesses. So really want to reiterate what we've heard from all of our panels, that the panelists, is that the best thing we can do right now is to stamp down this spike as quickly as it went up, and that way we can really support our local businesses. There's also been some questions about enforcement in the chat, and I'd want to just reiterate that the county continues to work with our city partners and the town of Truckee to collaborate on reaching out to businesses where we receive complaints that they aren't following the COVID guidance, and we will continue to do that. We've always taken an education approach in reaching out to businesses to let them know what the guidance is and to help them brainstorm on how they can comply to do the best thing for our community. We'll continue to do that. We'll continue to reach out to businesses, continue to provide the best technical support and the guidance that we can. But I think today, really what we're focused on and the challenge for all of us is what Michael articulated so well, which is that individual responsibility. And you know, we are here as a community to come together and each of us do our part to wear the mask, to not socially gather, as hard as that is, especially coming into the holidays. I know we're all dying to hug each other, and I've seen that in my friends and family as well, but this is not the time to let our guard down and to pretend that this isn't a real threat in our community. So I want to thank our panelists for their time and their dedication to our community, and want to ask you to please really look at what you personally can do to help our community get through this. It's time for all of us to make a personal commitment to take action. And that might mean changing our plans and canceling an in-person Thanksgiving. It might mean just committing to getting takeout from a local restaurant once a week to help them get through this. It might mean giving to a local nonprofit on Giving Tuesday, which is coming up on December 1st, because we know so many of our nonprofits have also been hit. And the holidays are often a fundraising season for our nonprofit community, and that's not going to happen this year the same way it has in the past as well. We are a creative and kind community. We take care of each other. And at this point, we really need to harness all of that creativity and kindness to be creative about how we're going to get through this holiday season together. So again, maybe rethinking your gift giving list or your wish list to include a 2021 membership to a gym or an arts organization, or a gift card to a local business, or movie tickets to Sierra Theaters to be used as soon as they can get back open. Really think about how we can support each other and use the holiday season to come together. And we really ask for your support in doing that. As Michael mentioned, the 2 vaccines really do provide us with a light at the end of the tunnel. But right now we are still in the darkness of this tunnel, and emotionally we're exhausted. Financially, people have been devastated. But now is really the time that we can pull together and make a difference for our community. So we have 231 people on this call right now. And we know that if 231 of us do this, that won't be enough. So I'm asking each of you to think beyond what you can do, to reach out to 5 of your friends or family members and ask them to join you in this pledge and figure out what they can do, and ask them to contact 5 people and them to contact 5 people. As we were thinking about how do we spread this word and how do we work together as a community, we thought about how well we came together through our Ready Nevada County campaign and your Find Your 5 campaign. So we asked people to reach out and find the 5 people you're going to make sure has an evacuation plan and a go bag and is ready for an emergency. And so please think of this as a similar emergency and reach out to your 5 and find your 5 and ask them to please join you in supporting our local businesses and wearing your mask, in canceling in-person social gatherings. We know it's really hard. We're all on Zoom all day for work. It's exhausting, but that's really the safest way for us to connect with each other at this point. So I'm asking you to please consider taking that action because really the actions that we as a community take in the next 3 weeks can make a huge difference for salvaging that holiday season, as Michael mentioned, for our businesses in our community. If we can get this case count down in the next 3 weeks, then businesses have a chance to reopen before Christmas. They have a chance to be able to bring in more business as that holiday season progresses. So please really think about what you can do to support our community. And thank you so much for joining us tonight. So with that, I'm going to take one more look at the chat. I'm also going to ask our panelists if they have final thoughts that they would like to share. This meeting is recorded. It will be available on YouTube. So we please encourage you to share this message and share the link with your family and friends so that we can all get the information that we need to help our community get through this. So any of our panelists have a final thought that they would like to share? Dr. Evans.
Yeah, Molly, I just want to add a little bit to that. I appreciate the message. We've kind of said a couple of times, light at the end of the tunnel. There's a light at the end of the tunnel. I think Dr. Hicks actually said on a previous call I was on, it's our obligation to get as many people to that light at the end of the tunnel alive as possible. This is about our community, about our businesses and everything, but it's also about life and death, frankly. And if we can actually slow down the spread of this virus, we will save people's lives. So I want to put a pitch in for that. I think that's really important. As far as commitment to the community, I think we all need to do that to support our businesses. 100% of my holiday shopping will be local businesses here in the county, nothing online. And I think that we should all do that. I think that we should all just do everything we can and buy more than you would have if you can afford it. I know people are struggling right now, and it's just been a heck of a year, but we got to do what we can to make it through, and we will make it through.
And I would add to that, shop local. Don't drive down to Roseville to get your Christmas gifts. Buy them up here because traveling out of county is certainly not advisable at this point. And I would just echo what everyone else has said. And then it's been, unfortunately, I think framed as an either or choice kind of since the beginning of this between either our economy and COVID safety and public health. And it's not an either or choice. Those two things are tied. The best way for us to protect lives, as Dr. Evans said, is to get on board as a community with this. And that's also the best way for us to get our businesses back open and operating as quickly as possible. So I want to thank everybody that's joined and listened to us today. And thank you for getting the word out to the community.
I have a question actually for you, Ryan, if you don't mind. Someone mentioned today that they thought that there was a revision to the blueprint that says that we don't have to stay with the numbers for 2 weeks before we can move into another tier, that it's just 1 week. Is that true, or is it 2 weeks of data before we can return back to red?
Yeah, so under the normal operation of the framework, you have to be 2 weeks meeting the criteria for the next tier to move forward. And additionally, you have to be in the tier that you're in for at least 3 weeks. So really it's 3 weeks to move forward between tiers. There have been discussions, and I alluded to this in answering one of the questions around, so they kind of operated the emergency provisions of the tiered framework to move us backwards more quickly. And there have been pretty lively discussions with the counties about once the conditions improve, if the data on the ground supports doing this, would the state be willing to move forward more quickly? So there are definitely ongoing discussions on that. No guarantees that they would do that, but in recognition, I think that we kind of had to take this emergency action. There may be some willingness to move forward more quickly if we can get it under control.
Great, thank you for that, Ryan. Yeah, I think that the governor used the term emergency break in his press conference on Monday, and that really does feel like that's what's happened. And so we really appreciate everyone tuning in today and joining this conversation. As I mentioned earlier, it will be available on YouTube, so you can share this meeting with people who maybe haven't seen it. And also, I think that Taylor posted in the chat the link to the state's website, the Build It or the Safer Economy page, which is where you can find out if your sector is what the restrictions are, or what's allowed to be open. And then finally, please, especially businesses, if you have questions about what you're allowed to do, or you're asking for technical assistance, or you have any questions, please do reach out to the county through our COVID-19 recovery email address. As I mentioned earlier, we respond to all of those emails, and we really do want to hear from you and see what we can do to help you get through this. So with that, I think we're going to end our meeting for tonight, and everyone take care. Remember to please find your 5, make your plan, and share it with your friends and family, and ask them to do the same, and we will get through this together. So thank you so much.
Thank you very much. Be safe.